Hello, I'm Dr. Ramanjaneyulu, gastroenterologist. Today, I would like to tell a few things about acid peptic disease, that is ulcer disease. Ulcer disease is one of the commonest disease, gastrointestinal disease, and most often many of the individuals, almost all of the individuals, they experience the abdominal pain or burning in their lifetime. And ulcer is one of the commonest cause of this upper abdominal pain, burning pain. That is acid peptic disease. Acid peptic disease, that means a peptic ulcer can occur anywhere in the GI tract. The common sites are the first part of the duodenum, that is the bulb. It is the commonest site, though these peptic ulcers can occur anywhere in the GI tract, and the second most common site is the stomach, but they can also occur in esophagus, small intestine, and very rarely in the large intestine also. But today we will confine ourselves to a duodenal ulcer disease. It basically presents with an abdominal pain, particularly with a feature of periodicity. That means few days or a few weeks this burning pain is there in between the pain-free intervals. Most often typically this burning pain occurs over 1.5 to 2 hours after taking in a meals, and some of those individuals they do get a relief on taking a food again. And nocturnal pain and periodicity is one of the classic features of an ulcer disease. But once we know that this ulcer disease, that we should know why it occurs. And most often it is because of an H. pylori infection. 95% of the times H. pylori infection is the cause for the duodenal ulcer and acid peptic disease. Over a period of time, it causes a gastritis, chronic gastritis, antral gastritis, and that because of neurohormonal changes, the ulcer disease forms. In very less number of patients, that is less than 5% of the patients, H. pylori is not the cause. In them, the chronic usage of painkillers, etc., or some of the other diseases cause ulcer disease. But by and large, commonest cause of an peptic disease is an H. pylori infection over a period of time, giving to gastritis and duodenal ulcer disease. We should know about an ulcer disease because it's the commonest clinical condition, but of course it is easily treatable, easily diagnosed with an endoscopy, that is with the latest RNA video endoscopy. It is easy, like anyone who is having an abdominal pain. If you suspect clinically the ulcer disease, the first test you do is a video endoscopy. Video endoscopy gives us not only to diagnose the ulcer disease, but sometimes also it gives the idea about the complications of an ulcer disease. These duodenal ulcer patients mainly they develop complications like a GI bleed, one of the commonest medical emergency which we see in a day-to-day practice. And some of the times they also develop a perforation, which is also an emergency because ulcer can get ruptured, giving a perforation peritonitis, which may potentially endanger the life. And rarely it also causes the gastric outlet obstruction because of the duodenal stenosis or a narrowing, where the food doesn't pass on to enter into a small intestine, giving rise to vomiting, particularly the stale food vomitings. That means the complications of an ulcer disease are upper GI bleed, gastric outlet obstruction, perforation, and these are almost medical emergencies. But when you diagnose this ulcer disease, someone has any symptoms, and if you treat these, definitely you can almost always avoid these complications of an ulcer disease, that is a GI bleed and also the gastric outlet obstruction, perforation. That means when someone has these complaints, upper abdomen, is suspect an ulcer disease, endoscopy we should be doing. It is not only confirms the ulcer presence of an ulcer, it's also size and Also, we can, in the same sitting, we can do a test called rapid urease test or a urease test, that is called rapid urease test, RUT what we call, and to detect the presence of an H. pylori bacteria. And 90% of the times with a triple regimen you can eradicate this H. pylori infection, and by there the ulcer heals within almost 2 to 4 weeks. But not only the endoscopy is not only diagnosed but is also used to treat the complications of an ulcer disease. When someone has a perforation, it can be closed endoscopically. But one of the main therapeutic form, particularly in those people who have a complication of an GI bleeding. When a duodenal ulcer bleeds, and depending on endoscopic criteria, we can offer the endoscopic treatment to control this bleeding, particularly in those individuals who are having an active spurter with leaking of a blood like a jet from the small vessel underlying the ulcer can be clipped so that immediately bleeding stops. And those who have other signs of a recent hemorrhage, depending on that, one can extend the endoscopic treatment to control or to arrest that bleeding, so that thereby saving the life. That means ulcer disease is one of the common clinical problem, presents with an upper abdominal pain, and it is easy to diagnose, and video endoscopy is one of the mainstay to diagnose. And it's not the H. pylori bacteria is the 95% of the times it's responsible, and if you eradicate the H. pylori bacteria, ulcer automatically heals. And the complications are sometimes life-threatening, but endoscopy is the mainstay to manage or to control, to treat these complications, more so the GI bleed. Thank you.